Welcome to the Clinical Education Initiative podcast, Conversations with CEI, where we feature conversations with clinical experts, their experience and insights on current health issues in the areas of HIV, primary care and prevention, sexual health, hepatitis C, and drug user health.
Hello, welcome to Conversation with CEI. My name is Juhua Wu. I'm the Director of Center for Community Practice at the University of Rochester Department of Medicine, and I'm on the team of our CEI Sexual Health Center of Excellence. I will be your host today, reporting on our 11th Annual New York State Sexual Health Conference. This year's conference is held close to our home location in Rochester, at the Hotel Canandaigua in Canandaigua, New York. This is only our second in-person conference since the COVID pandemic. We have more than 200 guests here and more than a dozen exhibitors from across the state. The conference covers topics from epidata, doxy-PEP, unusual infections and outbreaks, injectable PrEP, street medicine, syphilis roundtable, and more. This is also the first year that we have diagnostic lab companies here sharing a variety of STI testing technologies. It's just amazing to see everyone here ready to connect and learn and embracing a sense of community. I talked to a few of our speakers at the conference to share their presentation highlights and perspective. I'm here with Dr. Rachel Hart-Malloy, Director of New York State Department of Health, AIDS Institute, Office of Sexual Health and Epidemiology. Hi, Rachel. Welcome to the conference.
Thank you so much. It's a pleasure to be here.
Yeah. For the listeners who don't know you, would you mind sharing a little bit about yourself and what you do at the office?
Absolutely. So I direct the Office of Sexual Health and Epidemiology, as you said. Our office is comprised of two main units, one that oversees STI surveillance and special project analytics, and another that's over education, policy, and programming. So in my role, I really try to support the mission of the office and the vision of the office, which is to ensure that all residents of New York State have access to equitable sexual health. And so it's really about ensuring that people have access to information and resources. They know their rights, they know what's available to them, and that they can reach and maintain sexual health.
I know it's still early. You just gave a wonderful talk on the state of the state. Before I asked you to kind of share some takeaways and key points of your talk, what have you noticed about the conference? What has caught your attention?
People are so excited to be here. This is a wonderful conference. This is the 11th annual conference, and people are happy to see friends. They're happy to see colleagues. They're happy to see excitement in the field of sexual health and STI work. So the takeaway for me here is really the long lines and the smiles on people's faces to just be part of this community today.
Yeah, wonderful. Yeah, thank you. In terms of your talk, for the listeners who weren't able to come to this conference, what are the 2 or 3 things that you really want to convey to them?
Sure. In my presentation, I talked about the state of sexually transmitted infections. The largest takeaway that I hope people were able to observe is that there was a large decrease in syphilis diagnoses in 2023 compared to 2022. And these decreases were across all racial ethnic groups, sexes at birth, and region. And this is after sustained increases since 2018. So that's a success we need to be able to celebrate. However, despite this success, New York State continues to have observed increases in chlamydia, gonorrhea, and most notably congenital syphilis. The second point that I want to take is all of the work that we're doing in response to this. I wasn't able to get to everything that we do because it's a very long list, but the health department is working diligently to support response efforts through making sure that we have educational materials that are available to consumers and providers, publicly sharing data through various means, including a newly released STI dashboard, our New York State Sexual Health Dashboard, and supporting newer sexual health approaches such as syphilis point-of-care testing and provision of doxycycline post-exposure prophylaxis. I do have a website. I am going to name it here so folks can go, but we have our materials at health.ny.gov/healthy sex.
How do people in this field keep the momentum of these hard-earned STI declines?
Absolutely. That's a great question. So, though 2024 data are not yet final, the promising declines in syphilis appear to have continued. So that means that the momentum you mentioned is absolutely present and we need to keep going. So in addition to supporting a general sex-positive approach with all patients, supporting patients and finding the right sexual health options, we have to make sure that there's a shared clinical decision-making in all of this. For the first time, this includes more than condoms, right? So we have more than condoms and test and treat. We can meet folks where they are with syphilis point-of-care testing, at-home STI testing, DoxuPEP, and EPT. There's a lot of free materials available, so if we're talking about funding, I think it's important to share our materials are free and available again on that website.
Okay, great. Thank you so much, and enjoy the rest of the conference. I am here with Dr. Brenda Tesini. Dr. Tesini is an associate professor with University of Rochester School of Medicine and Dentistry. Welcome to the conference, Dr. Tesini.
Thanks. Wonderful to be here.
Yeah, so for the listeners who don't know you, would you kind of share a little bit about yourself and what you do?
Sure, I'd love to. I'm an actively practicing infectious diseases clinician. I see patients in the hospital, both adults and children, with possible or proven infections. I'm also a hospital epidemiologist, which means I help track and prevent infections within the hospital, particularly infections that may have certain drug resistance. And I do surveillance for infections both in hospitals and in the community.
So you just give a really fascinating talk titled STIs, the list is growing, unusual infections and outbreaks associated with sexual transmission. For the listeners who can't come to this conference, what are a few takeaways that you would like to convey about your talk?
Yeah, I think it's always important to think outside the box a little bit. And so if you're seeing an infection that you wouldn't normally think of as an STI or sexually transmitted infection, to take a sexual history and ask about their sexual practices specifically, because those can really help clue you in as to how a disease is spreading.
Yeah, I know we're at a lunch break right now. I don't know if you had a chance to kind of check out the exhibits and look around. So what has captured your attention at this conference so far?
Some of the messaging from the New York State folks, really exciting messages about sexual health and just positivity for everybody and encouraging testing and prevention. It was really exciting to see. I think the effort that's taken to reach all sorts of audiences was encouraging and exciting.
Yeah. So enjoy the rest of the conference.
Thanks.
I'm here with Michael Brennan. Michael is a nurse practitioner with Regional Health Reach. And welcome to the conference, Michael.
Oh, thank you so much. It's great to be here.
Yeah, you just gave a fascinating talk around street medicine. And I'm curious, for listeners who don't know you, could you share a little bit about yourself? What do you do and how did you get into the field?
No, thank you so much for asking. I've been a nurse practitioner for close to 35 years, and I've tried to dedicate my career to serving the marginalized and underserved. So at times that has meant working with refugee populations, the uninsured, the migrant farm worker population, and now the unhoused. And I've been doing street medicine for 3 years with Rachel Health Reach, and it is gritty but gratifying work. We're out on the streets 5 days a week, taking care of our brothers and sisters who maybe have a mental illness, probably have an opioid use disorder, may have wounds, and have all kinds of other primary care needs, as well as STIs. So we're busy.
Yeah, you just gave this wonderful, fascinating, and interactive talk around street medicines. And some of the listeners couldn't make it to the conference today. So if you were to convey a few key points to the listeners about your talk, what would you say?
I think for people that aren't here at this conference, what I would like to convey is the importance of meeting people where they're at, both figuratively and literally. That's what we try to achieve as street medicine. to have a no judgment zone, and to not practice patient-centered care, but patient-led care, where patients know best sometimes, most of the time, what their priorities are in terms of their health and what they need, and we try to facilitate that. We deal with a lot of complex cases, and the cases we deal with are because of a multi-system failure of our safety net. There's huge holes in the safety net, and our patients can't get quality care. They don't have an address, they don't have a phone, they don't have transportation, they don't have a job. So it's just really challenging on the streets, and we are standing in the breach to do our best to support people and to love them.
Yeah, so Michael, like you shared, street medicine, this is not an easy field. How do you keep yourself going, keep the momentum going each day?
I feel so blessed and fortunate to be able to do this work because I work with good people, because it's good people that want to work in this field, but I work with great patients. And our patients have been so stigmatized and by our society and made to feel invisible that when we care for them and show them compassion and empathy, they respond so beautifully with, sometimes it's gratitude and sometimes it's just trust. There's a word in Spanish, confianza, which implies trust and confidence in a relationship. And our patients give us confianza. They trust us. They open up. They share of their past woundedness, their trauma, their suffering. That's sacred, to be brought into that with another human being and to maybe be able to play a role in helping to heal.
Wow, that's a beautiful insight, and we really feel your compassion there. Thank you so much. Enjoy the rest of the conference.
Oh, thank you so much. It's great to be here.
I'm here with Dr. Jeremy Kidd, who just gave a really fascinating talk about harm reduction and health promotion strategies with people who engage in chemsex. And Dr. Kidd is an assistant professor of clinical psychiatry with Columbia University. Welcome to the conference, Dr. Kidd.
Thank you so much. It's great to be here.
Yeah, for our listeners who don't necessarily know about you, Dr. Kidd, can you kind of share a little bit about yourself? What got you to this field?
Yeah. So currently I work as an addiction psychiatrist. I do research focused on alleviating substance use disparities among LGBTQ populations. And then I also work clinically trying to help individuals with serious mental illness reduce their use of substances as well, which is with schizophrenia or bipolar disorder. So we're in kind of a clinical and research hat. I got into this field really through firsthand experience with harm reduction, helping with harm reduction efforts and syringe exchanges, but also with sexual health promotion, noticing the overlap between these two things, between sexuality and drug use, and how treating them separately really didn't seem to serve anyone very well, and really trying to take an integrated approach in the clinical work that I did.
And then your talk that you just gave, it was really interesting and informative. For our listeners who can't make it to this conference, what would you like to share with them, some key points from your talk?
Yeah, first, I think that chemsex is a specific term that's different from people just using drugs and combining it with sex, but it really is people using drugs with the intent to positively impact their sexual experience. That is most common among subgroups of sexual minority men and trans women, and as such, has a lot of psychological motivators as well. People wanting to feel less isolated, people wanting to manage feelings of stigma, people wanting to manage feelings of self-confidence or sexual confidence. And it really is a kind of different animal from just using drugs and sex. That individuals who engage in chemsex are some of the individuals at the highest risk for HIV infection and transmission, but that there's some really important harm reduction points that we can make to help people reduce their risk of both HIV infection, but also things like drug overdose, and positively impact the lives of people who are engaging in chemsex.
Yeah, and now we're approaching the end of the conference. I wonder if you had a chance to kind of check out some exhibits and what really piqued your interest and what has captured your attention at this conference today.
Yeah. One of my favorite presentations was a presentation I went to by someone at the University of Rochester about long-acting injectable PrEP and PEP formulations, and both the promise of those, but also the challenges in implementing those. That interested in me because I think in individuals who engage in chemsex, who often have a very hard time keeping up with daily oral medication regimens, long-acting injectable PrEP and PEP to treat and prevent HIV really has so much promise. It was very interesting inspiring and disheartening to hear about some of the logistical challenges around that, as there is with everything in medicine. It's very complicated to implement these things, but it was very interesting to hear about the new long-acting injectables that are on the horizon as well that may be able to help this population especially.
Yeah, great. And not only that part is difficult, has been a lot of challenges around sexual health and public health these days. How do you keep yourself going?
It's a great question. Something I think about almost daily these days. I think the first is surrounding myself with colleagues and friends who are like-minded and working in the same space and care about this work as much as I do, who can lift me up and inspire me with their work, even when my own is encountering impediments. I think that's the biggest thing, a sense of community, which this field has always been really good at fostering. And then being flexible. And I think one thing about harm reduction is it makes us consider other kinds of treatment goals. And I think that mindset is really helpful in this too, that there's a bit of like a grieving of the kind of work or impact the program that you wanted to have, but being flexible and thinking about other areas where you might be able to still impact the community around you in a different way.
Yeah, thank you so much for that. And at this conference, we certainly feel a sense of a community together here. Yeah, thank you, Dr. Kidd. Enjoy the rest of the conference.
Thank you so much.
Thank you for tuning in. Join us next time for a new episode of Conversations with CEI. Visit us at ceitraining.org and follow us on CEI social media platforms.